welcome to my video. For more educational videos, please subscribe, like and share. Let's get started. Film is consisting of mucoaqueous layer from the inner side, then lipid layer on the outer side secreted from the meibomian gland. The eyelid is like a wiper on the windscreen, and there is thousands of molecules that help the immune system of the eye in the aqueous layer. The aqueous layer is secreted from the main lacrimal gland in the orbit, then drained through the tear duct. And the tear film is a very thin layer that is 1/3 of a human hair, and the oily part is secreted from the meibomian gland, the aqueous part from the lacrimal gland, and this helps to differentiate the dry eye disease, the lipid deficiency and the aqueous deficiency. This is a case of mask associated dry eyes that the patient is having mild dry eye, and if we had a more magnified view of the lacrimal system, the tear film and the tear meniscus. Here is another case of mask associated dry eye, and you can see the gap between the mask and the eye that makes the symptoms of dry eye more obvious. And this is another severe case of meibomian gland dysfunction, and there is deficiency of the oily layer, and you can see the inflammation around the meibomian glands behind the eyelashes. This is another case of meibomian cyst, that the secretion is very thick and it is not oily, but it is more greasy, that is blocking the opening. This is another case of mask associated severe dry eye of aqueous deficiency type, and this is an autoimmune disease of the lacrimal gland. And here you can see the frequent blinking of the patient. And when we elevate the upper eyelid, you can see that the upper eyelid is having some signs of dry eyes in addition to the corneal affection, and the tear meniscus is very thin in these cases. Staining with fluorescein stain, you can see here the corneal affection is very obvious. So how to deal with this made cases, mask associated dry eyes? First, you have to fit your mask correctly, and you can tape the mask on your nose, but avoid taping the eyelids. Take regular breaks, and the 20-20 rule, you can use that in your daily practice. Avoid touching or rubbing your eyes, and use eye lubricants. Use eye masks and cleaning the eyelids. In severe cases, you have to consult specialists. And you can see here the punctal plugs that are stopping the drainage of the tear film to the tear duct and helping in cases of severe aqueous deficiency. And you can see the white arrow is pointing on the plug that is keeping this small amount of tears to lubricate the surface of the eye. And the IPL is an advancement in this field as well. You have to know that there is no cure but control in mask associated dry eyes.